Hi, my name is Jordan Fitzpatrick, and I'm a third-year occupational therapy student at The Ohio State University. I'm presenting my capstone project on evidence-based strategies for parent training on play for children with sensory concerns. The purpose of this capstone project was to synthesize the evidence supporting parent training on play for children with sensory concerns and develop a parent training program at Pediatric Therapy Partners. Prior to beginning my capstone experience, I conducted a scoping review to answer the question, what play-based intervention models within the scope of OT best address and promote parent-mediated play among children with autism displaying sensory concerns? This is important because parents play an important role in a child's development of all skills, including promoting the social, emotional, cognitive, language, and self-regulation skills that build executive function and a prosocial brain. Children with sensory processing concerns demonstrate differences in participation in play compared to their typically developing peers. If the parents do not feel confident in their skills to engage in play with their child with sensory processing challenges, then this can hinder their relationship and impact the child's development. Therefore, parents may need guidance on facilitating play with their children. Occupational therapists can assist parents in developing their role in play. The scoping review was completed according to PRISMA, following the scoping review guidelines. The databases used were PubMed, AOTA, Google Scholar, Cochrane, ScienceDirect, and EBSCOhost to achieve the articles utilized for the scoping review. The search terms included topics such as sensory processing, play-based intervention, occupational therapy, children, and parent education. This yielded 541 results. After removing duplicates, title and abstract screening, and full-text reviews, this left 9 articles to be assessed for eligibility using the inclusion and exclusion criteria. Included studies were from peer-reviewed journals and were published within the last 10 years. Participants in the study were children between the ages of 1 and 7 that were typically developing or diagnosed with autism that were displaying sensory concerns. It also included play models that incorporated sensory concerns, involved parent mediation, and were provided by an occupational therapist. Exclusion criteria entailed children younger than 1, not play-based, nor involved sensory concerns. The 9 studies included were critically appraised using the Cincinnati Children's Legend appraisal form. A concept map was created to visualize the various themes, and a thematic analysis was then completed, pulling information from the articles for each theme. In the concept map, you can see the 4 themes that were created based on 5 different play-based intervention models: STAR process, the developmental individual difference relationship-based model, early start Denver model, and general models. The active ingredients or the developmental strategies for parent-mediated play-based interventions included engagement, regulation strategies to adjust arousal, interpersonal connection, following the child's lead, social emotional attunement to affect the enjoyment, implementing the play strategies that were appropriate for their child's current level of functional development, and the use of sensory integration activities and parent mediation. The capstone experience was completed at Pediatric Therapy Partners. Pediatric Therapy Partners, or PTP, is a sensory integration-focused clinic in Lewis Center. The majority of the clients have sensory processing challenges, and a good portion of those children have autism or are displaying signs of autism. The parent education program utilized principles addressed in parent-mediated interventions such as DIR floor time, STAR process, and those addressed in sensory-based treatments. The principles included in the parent education program were importance of play, engaging in child-led play, principles of sensory integration, sensory systems, the benefits of understanding signs of dysregulation, strategies for regulation, and successful transition strategies. The parent education program incorporated 4 themes: importance of play, sensory and play, regulation, and transition. The program was structured as 1 theme per session over 5 weeks, where the parents were asked to watch the pertaining video recording before the session and look over the worksheets. The video recordings were about 30 minutes each. Then at the end of their child's session, there would be an open discussion for questions about topics covered, novel use of strategies, or brainstorming personalized ideas tailored to their child. The final algorithm included children with autism with sensory processing concerns, children displaying sensory concerns, or parents wanting more information on play training or their role in play. As far as the frequency, this would be listening to a 30-minute video recording 1 time a week, review of worksheets, and open-ended discussions at the end of their child's session. discharge criteria would entail an increase in parental sense of competence. There is currently no program in place because of time constraints and full caseloads that the OTs have at PTP. So I created this program, and in order for it to be feasible, it was altered to being virtual. A pre-survey was utilized prior to implementation of the program that included 2 to 3 questions from each of the 4 themes. The questions were asked on a scale of 1 to 10, rating their competence within the realm of each theme. There were also open-ended questions where the parent could provide information as to what type of play activities, sensory play activities, and strategies were used for both dysregulation and transitions. A post-survey was completed after completion of the parent education program to assess if the parent's level of competence increased and to assess if new strategies were being incorporated at home. The following graph depicts the average score reported for the 4 families before the program and after completion. Following the program, all 4 families were trying new sensory play ideas, regulation, and transition strategies. Some of the various examples being utilized were multisensory play, a secret model, visual routine, social stories, and utilizing a trial and error method for transition strategies. The concept of the A-secret model is a process of problem-solving solutions that work to support a child when they are experiencing sensory challenges. Each letter is an acronym that can be used as a strategy by the parent to help their child regulate. There will be an example of this image later in the slides. This is the pre-survey that shows the 1 to 10 rating scale and an area for open question discussion. The parents included in the program displayed an increase in parental sense of competence and competence. Per parent report, there also had been a decrease in stress around the realm of play, where parents felt they had a better understanding of what to do during play and felt equipped with different strategies. After completion of the program, the therapists at PTP demonstrated an interest in the future use of the materials for additional parents wanting knowledge. The overall impact of this program was positive for all involved parties. This program encouraged shared learning between disciplines and clients at the clinic. However, due to therapists' busy schedules, it may not be feasible for them to implement this program exactly as recommended, which is seen to the right on this slide. This is dependent on their schedules and time constraints. However, the therapist can provide a theme based on what a parent would like education on and could benefit from the resources. In addition, these resources could become part of their onboarding process for new families at PTP. I had the opportunity to participate in different treatment interventions during my capstone experience. I participated in planning and implementing sensory integration treatments with pediatric participants. I engaged in play-based co-treatment opportunities with speech therapists, and I had the opportunity to observe Kay Bourne perform neurofeedback on her glands. Neurofeedback is a learning modality that normalizes and optimizes brain functioning. It can help shift the way the brain produces and distributes its electrical energy. By showing the brain its own state of regulation, it can improve regulation and functioning. I also had the opportunity to utilize, score, and interpret various assessments such as the sensory profile, the behavior rating inventory of executive function, the PDMS-2, and the TAPS. I also developed parent education learning materials to be utilized at PTP with future clients, such as both videos and handouts that contain evidence-based knowledge and education from occupational therapists from PTP. Also on the slide are some of the slides from the parent education program that were included in the video recordings. I had the opportunity to go on school visits with OTs from PTP, where I observed individualized clients from PTP to assess the child within their school setting, and to provide teachers examples of how to assist the child struggling with sensory challenges in school. I also assisted K-Born in educating high school art and music teachers on sensory integration and how to make classroom sensory friendly for their students. I had the opportunity to participate in a drum circle with co-workers from Pediatric Therapy Partners. This was led by Kay Bourne, who was trained in group empowerment drumming by Health Rhythms. Group empowerment drumming is a comprehensive, whole-person, evidence-based therapeutic program for all ages. Participants follow the Health Rhythms 10-step protocol initiated by the instructor and have the opportunity to use a drum as a tool for communication and personal expression. Benefits of participating in the group empowerment drum circle are improved social engagement and mood states, decrease in anxiety and depression, boosted immune function, enhanced motor skills, and reduction in stress and burnout. I would also like to say a special thank you to Kay Bourne and Nicole Studer, my site mentors at PTP, who supported me throughout my capstone experience and helped me to develop a deeper understanding of sensory integration. I would also like to thank the staff, the patients, and the families at PTP for such a rewarding experience. I would also like to express my gratitude to Jewel Cresta for assisting me with the literature reviews, the capstone project, and the final defense. Also to the OSU OTD faculty, staff, and students for their support throughout this experience. Thank you for your time.